I'm Dr. Thomas Hedberg with International Medical Crisis Response Alliance, or IMCRA, and this is the third module in our series about coronavirus. And in this one, we're going to take a slightly different approach and ask you to think like a coronavirus. First of all, of course, the virus doesn't think about anything except infecting you. So in our new age of social distancing, we certainly don't want to limit human contact further and wind up advocating a fad of extreme antisocial or misanthropic behavior. Also, a lot of us are sick of hearing about nothing but coronavirus at this point, and we're tired of the precautions. However, the grim reality is that we can pretty much only contract COVID-19 from other people. And until the pandemic is effectively under control, extreme caution is not only wise, but a social and familial responsibility. It may be easier if we think of these recommendations as only temporary measures, something that we need to exercise for just a few weeks or months or so, with our good old uninhibited level of human contact resuming as soon as this pandemic is under control. So let's think for a few minutes like a coronavirus and review some of the unanticipated ways it may enter your body. 1. We didn't visit our regular restaurant. Instead, we ordered out. Gotcha. Do you know who prepared the food? Did they happen to cough on it? Do you know who wrapped it up and what they might have had on their hands? Think about it first. Number 2, we kept our distance from everyone at the event we attended, more than 10 feet at least. Gotcha. What happens when that non-symptomatic but infected guy coughed or sneezed across the room? Virus particles were wafted into the air and perhaps drifted over to our side of the room where we inhaled them. Think about it. Number 3, I wore gloves and a face mask when I went out, so I'm well protected. Maybe not. First of all, the face mask accomplishes very little, since airborne virus particles can easily be breathed in unless the mask is firmly sealed around your nose and mouth. Second, if there were virus particles on whatever you touched with those gloves, they're still on those gloves and will be transmitted to whatever else you touch with them. Car doors, doorknobs, whatever. Finally, when you removed those gloves, did you pull them off by the fingers or remove them from the inside out? If you did the former, it's unfortunately another gotcha moment. Number 4. I needed to review those documents my colleague provided in my mailbox or on my desk. Fine, but what was on the surface of the papers you touched? Was your colleague infected but asymptomatic? Did she perhaps exhale virus particles onto the paper? Do you want to take that chance? Number 5. I took the kids to the playground. There was no one else there, so I'm sure everything was safe. Are you really sure? Who was climbing on the monkey bars before your child, and how long ago? The virus can live on hard surfaces for up to 72 hours. Is it wise to assume they are clean? Or is it perhaps a better idea to wipe down with disinfectant all touchable surfaces before your child comes into contact with them? Number 6, I have to take the train or bus into work or to go shopping. I have no other options. Fine, but it's still a risk. Think if it's possible to have a really careful family member or friend do the shopping or the running around for you. Also, ask your boss or colleagues whether it's really impossible or not for you to do your job remotely. If not, it should be no embarrassment to wear a tightly fitting surgical mask or gloves to work, and to remove them carefully when done, in line with what we recommended earlier. Number 7. I took all the precautions I can possibly take. I have to live with the risk. Sure, and this is perfectly understandable in so many cases, but you can maximize your chances of not getting seriously ill if you do come in contact with the virus by getting plenty of sleep, making sure you take appropriate vitamins, getting out in the fresh air and sunlight as much as possible, and basically maintaining optimum physical health by eating right and limiting your stress levels. Finally, number 8. My nose really itches. I just need to scratch it or pick it. And my eyes are also pretty itchy. Surely, after all the precautions, this should be all right. Unfortunately, this is one last gotcha moment. The coronavirus enters the body most easily through moist mucous membranes, which means your mouth, eyes, and nose. If you must scratch that itch, at least wash your hands thoroughly with soap and warm water for 20 seconds, at least, just before doing so. That's it for today. We want to thank you once again for joining us. Please look for further information concerning coronavirus and updates at our website, www.imcra.net, as shown here, or Google IMCRA IMCRA globalgiving.org. Thanks again for joining us, and good health.